Good afternoon, everyone, and welcome to today's webinar titled Assessing Family Support, Assessment Tools Used in Parent Support Services. Presented by Fredler, the family-run Executive Director Leadership Association. We're building leadership and organization capacity for family-run organizations. My name is Gail Cormier. I'm the Executive Director of North Carolina Families United, and I am the President of the Board of Directors for the Family-Run Executive Director Leadership Association of Fredler. This webinar is being provided today as a technical assistance opportunity as part of the TA Network. The TA Network is a partnership with 3 other universities and 7 organizations you see listed here. The TA Network provides technical assistance to the Child, Adolescent, and Family branch of SAMHSA's Center for Mental Health Services and to grantees of the Children's Mental Health Initiative across the nation to support states and communities to expand and sustain their systems of care for children, youth, young adults, and their families. Fredler's mission is to strengthen the leadership and organizational capacity for family-run organizations focused on the well-being of children and youth with mental health, emotional, or behavioral challenges and their families. Fredler provides technical assistance to the system of care grantees and family-run organizations in the form of webinars, topic-specific consultation, site visits, resource materials, leadership camps, and much more. We're excited that you have joined us today to hear about the assessment tools used by family-run organizations in tracking outcomes of the parent-to-parent peer support. Now I'll turn this over to Millie.
Thanks, Gail. Good afternoon. My name is Millie Sweeney, and I'm with Family Solutions Consulting, and I'm here on behalf of Fredler today. Today we're going to discuss the importance of assessment in family-run organizations, identify tools often used to assess parent support, and hear from several family-run organizations about their use of and experience with some of these tools. Sarah Nicholson of the Nebraska Federation of Families will share information on their use of the Protective Factor Survey. Nancy Craig of Families Together in New York State will discuss the Family Assessment of Needs and Strengths, or FANS. And Celia Sirkin of the Montgomery County Federation of Families in Maryland will describe their development and use of the Family Journey Assessment with Georgetown. There will be time for questions from participants following the last presentation. Please use the chat box to state your question, and we'll be sure to address them after Celia's presentation. Let's first explore the importance of assessment in family organizations. So why is data important? Collecting, analyzing, and using data is a critical component in any organization. Data is used to understand what is or is not working in programming and operations, allowing an organization to make effective decisions. Data is used to inform others, such as policymakers, funders, and other families and providers. For the individual family, data can help assess their progress toward goals. And data can provide overall accountability in an organization, as well as demonstrate credibility for the work you are doing. We all use data in some way. Families use data to track their child's progress and to strengthen their advocacy for necessary services and supports. Program staff use data to compare approaches and to gauge effectiveness of the services they are providing to families. Tracking individual data can help program staff to make accommodations, develop transition plans, and address the unique needs of children and youth. At the organizational level, data can be used to identify where resources are needed within the company and in building collaborations and partnerships externally. Outcome data is an effective component for marketing accomplishments and advocating at the policy level. Tracking and using information on the efficacy of your work is critical in sustainability for family-run organizations. It is important that we are able to show what we do works for families beyond the anecdotal data traditionally captured. State and federal agencies often use data to establish the need for increased funding or to demonstrate that an approach or program is cost-effective as well as outcomes-effective. Anyone who has been awarded federal grants is familiar with the reporting of data that is required to show that you are adhering to the terms of your grant. There are two basic types of data. Quantitative data focuses on numbers, quantities. Examples include collecting information on how many families you've served in a program or how many parents are involved in policymaking groups. Qualitative data involves descriptions and stories, focusing on the quality of a service or product. Family-run organizations are excellent at gathering the stories of families to use in advocacy and policy work, as well as to demonstrate how a service or system did or did not work for a child or family. Both types of data are important for family-run organizations to demonstrate their capacity to serve communities, the effectiveness of their programming, and the stewardship of grant or contract monies. Regardless of what type of data you collect or the method you use in collecting it, it's very important to ensure that the information you glean is shared. Establishing a feedback loop with families, funders, and the community promotes trust, allows for continuous quality improvement in your work, and builds more cooperation in both the collection and use of data. When others see how data is used to promote sound decision-making and effective services or supports, they are more likely to be open about providing information or participating in the assessment processes. Data collection is more than counting heads at a health fair or reporting on the number of parents attending a support group. Many family-run organizations are learning the importance of assessing their work and its impact on those they serve. Sometimes this is the result of a funder's requirement in reporting or is a cooperative effort in a system of care site. Assessment tools vary depending on what elements you wish to focus on, the budget that you have available for data collection and analysis, and your organizational capacity to be consistent in your data collection process. Let's explore what types of assessment tools are currently being used by family-run organizations across the nation. Please note that this is not an exhaustive list, and there are many other tools available. For initial survey results of FREDLA's National Data Collection Project, these are the most common tools used by family-run organizations currently. Pre- and post-surveys are easy to develop and use, taking account of the level of knowledge, skill, or functioning before a training or an intervention, and comparing it to the level of knowledge, skills, or functioning after training or an intervention. These types of surveys tend to use a Likert scale for the participant to rate their experience, such as rating from 1 to 5, with 1 being very dissatisfied and 5 being very satisfied, or choosing from a range of items such as a scale from no knowledge to very knowledgeable. Focus groups are another method used by organizations to capture data. A group of individuals, representative of the population served, is gathered and asked a series of facilitated questions to ascertain their feelings, opinions, and experiences about a particular topic. This yields qualitative data more than quantitative. Then there's the Child and Adolescent Strengths and Needs, or CANS. It's widely used and is an open domain tool that is free for anyone to use through its developer at the Praed Foundation. The CANS is a multi-purpose tool developed for children's services to support decision-making, including level of care and service planning, to facilitate quality improvement initiatives, and to allow for the monitoring of outcomes of services. It assesses the level of strengths and needs of an individual and can be used over time to show changes in levels of both, and in addition to informing development of an individualized service plan. An increase in strengths and a decrease in needs would indicate improvement. Modeled after the CANS, the Family Assessment of Needs and Strengths, or FANS, uses 17 questions from the CANS that pertain to the work of family peer support. The tool guides parents in identifying their strengths, as well as the skills needed to support their child and family. We'll hear more later in this webinar about the development and use of the FANS from Nancy Craig, a parent advisor, and one of the lead developers of the tool. Other common tools include the Family Empowerment Scale. That's a 34-item scale assessing empowerment in parents and other caretakers of children with emotional disorders. Empowerment is defined as the ongoing capacity of an individual to act on his or her behalf to achieve a greater measure of control over his or her life. It was developed due to the need for a brief, self-administered measure that could provide a snapshot of empowerment at one point in time. An example of the use of the Family Empowerment Scale by the Oregon Family Support Network will be provided on the next few slides. The Caregiver Strain Questionnaire assesses the extent to which caregivers and families experience additional demands, responsibilities, and difficulties resulting from caring for a child with emotional behavioral disorders, as well as the psychological impact of functioning as a caregiver. The caregiver's perception of caregiving strain is an important outcome of the child or family's treatment and also influences help-seeking and treatment experiences, components of the treatment process. Research has indicated that caregiver strain has important implications for how children use mental health services, is associated with parent involvement in their child's treatment, and likely impacts the effectiveness of the caregiver. There is evidence to suggest that reducing caregiver stress positively affects the use of mental health services, parenting, and the ability to maintain a child with mental health challenges in the home and community. The short form of this questionnaire contains 10 items with response options on a 5-point Likert scale. It measures caregiver strain in the previous month in terms of objective strain and subjective internalized strain, with the total score as the sum of those subscales. And finally, the Child and Adolescent Functional Assessment Scale, or CAFAS, assesses the degree of impairment in youth with emotional, behavioral, psychiatric, or substance use problems. The CAFAS provides an objective, comprehensive assessment of a youth's needs that is sensitive to change over time, making it the most widely used outcome measure available. Using information collected during a routine clinical interview, the assessor selects items that describe the youth's problematic behaviors, as well as strengths and goals. This is done for 8 life domains: at school, at home, in the community, which is also delinquency, behavior toward others, moods and emotions, self-harm, substance use, and thinking, which is assessing irrationality. A total score and subscale scores are generated, with higher scores indicating a greater impairment in day-to-day functioning. Therefore, as treatment or an intervention progresses, lower CAFAS totals and subscale scores indicate improvement. The CAFAS has a web-based software that can be accessed, but there is an annual fee, and there's a fee for each time the assessment is used. One example of how a family-run organization is using an assessment tool is the use of the Family Empowerment Scale by the Oregon Family Support Network. They began using the FES 2 years ago in order to provide requested data to a funder. Specifically, in receiving services, did the family feel that the process was family-driven and youth-guided? And did the family feel that navigation supports were helpful and contributed to the success of the child and family? OFSN also collects other outcome measures as well that are quantitative, including number of families served, timeliness of referral process, and number of outreach activities conducted to inform partners and referral sources about family support services. OFSN began using the tool to answer these questions and has found the results to be consistent. 78% of families expressed that planning processes were family-driven and youth-guided, and 80% felt that the overall quality of their lives and their health and wellness had improved. They are now incorporating the FES into all their sites and are now looking at doing a full cost analysis for family peer support. What should be emphasized in this example is how a family-run organization is consistently collecting data and using this data in multiple ways to promote the organization's mission, for reporting to funders, informing programming decisions, and informing the community of the effectiveness of family support services. An example of how they relay what they've learned through data collection can be found in their one-pager, and that's included as part of the materials you can download from this webinar. OFSN did note that this document is a few years old, so the cost information may need to be adjusted for cost increases in services, but the outcomes for family have been consistent. Now let's move on to several more experiences from the field. First up is Sarah Nicholson from the Nebraska Federation of Families for Children's Mental Health to discuss how her organization uses the Protective Factor Survey. Sarah?
Thank you, Millie. Welcome, everybody. Thanks for joining us today. I'm going to talk a little bit about the Protective Factor Survey and how we've used it here in Nebraska. Okay, so we actually started providing a more formalized family peer support service. It's been almost 5 years ago now. And when we established our new program, we found that it was going to be necessary for us to identify appropriate assessment tools. What we didn't know at the time was that there were so many options available. So we spent a great deal of time doing a lot of research and figuring out what the right tools were for the need that we had. So just kind of some background, in Nebraska, the Federation of Families is the backbone organization for the affiliate network. We have 8 family-run organizations in addition to the Nebraska Federation of Family within our network. We provide network management services as the blanket or umbrella organization, and the 8 family-run organizations span across the state of Nebraska and provide family peer support services to all counties and all families in Nebraska that are eligible. So this all began with, like I said, this need to determine an effective tool for families to use in our family peer support program. So we started off using the Caregiver Strength Questionnaire as our family assessment tool, and we absolutely loved the tool. It was providing us a lot of rich data. However, over time, we determined that it wasn't the tool that met our needs most comprehensively, mostly because of the different types of programming or different funding we were receiving for families, meaning that we had some behavioral health dollars and some child welfare dollars, and it wasn't answering all the questions that we had in relationship to working with families. So we went back on the lookout for a new tool. So again, we were looking for something that was measuring success for families, but not just on the family level. It was also helping us look for something on the program level for measurement as well as the system level. So once we did more research, we found some tools, and I want to share some of our experiences with that. But it was really about moving away from a deficit-based assessment tool and focusing on something that was going to help us assess a family's strengths and then how to build upon that. So we did a lot of research, like I said. We did what we called evaluation shopping, and we didn't know what we didn't know, and we learned a lot in the process. So there was certainly benefit in taking the time to do that research and talking to people that had used different tools and had different experiences with them, talking to families who had experienced having the tools used with them. It was just a lot of practicing and trying things and seeing what worked best for us. So what we learned, it was intriguing actually. Our first experience with the Protective Factor Survey was when here in Nebraska, Friends National Resource Center came here and did a presentation for one of our local collaboratives. And we were discussing how to implement outcomes in programs, and the Protective Factor Survey was one of the tools that they presented, and fell in love with it immediately. What we found is that it's a partnership or a collaboration with the University of Kansas Institute for Educational Research and Public Service, and it's an actual evidence-based tool, which was really important for us because of our funding sources. The Protective Factor Survey, the way it's set up is a pre-post evaluation tool, and it's used with caregivers who are receiving child maltreatment prevention services. However, having said that, it also seems to fit quite nicely within the realm of behavioral health. And it's a self-administered survey, and it measures protective factors in the 5 core areas, which are family functioning and resiliency, social support, concrete support, nurturing and attachment, and knowledge of parenting and child development. And it helps programs assess changes in their protective factors, which is a major focus of the prevention work we're doing, and probably a lot of you are doing. For us, it became more of a measure of programmatically, what did that look like for us? We had determined at that point in time that it was important for us to be able to look individually with each family at what their specific needs are, what their specific protective factors were, but also look for a tool that programmatically was telling us, are we building capacity for what we need to support growth of a program? For us, we learned that protective factor survey could do that. One of the things that also was helpful, at least for us with our lower budget, was that there was no cost associated with the tool. It's public domain, so anybody can use it, and the training materials are readily available. So it was more simple to put together a package. This is an example of the first page of the protective factor survey of the tool itself. And this is on our data management system, but like Millie had mentioned, a lot of our scales or a lot of our assessments are Likert scales, and this is no different. This one is a Likert scale. So it's important to understand the difference between program evaluation and family assessment. And actually, when Millie first contacted me and asked if I would present on protective factor survey, we had a brief conversation about that, because really the intent of the protective factor survey is not a family level assessment tool. It's a program assessment tool. So it's not intended to be used in that way, and so therefore we don't. However, what we found important, again, was to figure out how to mesh all of our things together so it made sense. So the protective factors there's more than just the measurement tool. There's a framework around it. So we adopted a framework in Nebraska that allows us to measure the protective factors as program outcomes, but then also on a family level, it helps us work with families in a very kind of informal way, the family peer support specialist and the parent, to identify what things are present right now. And we do this as a pre-assessment. What strengths do we have as a family? What are our protective factors? What do we need to enhance? And so that becomes our building piece from the very beginning, so that we can continue as a family to build on those things. But then that ties back into our program so that we can assess programmatically what things do we need to build within our program to support the growth with families. So the family level assessment brings to light the strengths and weaknesses of family dynamics and allows for members to consciously increase the influence of nurturing attributes while curtailing harmful ones. So again, we use it as an informal conversation with families. So if there's questions later, I'd be more than happy to answer that. Those aren't necessarily tools that I've seen other people using. They're things that we've created in Nebraska that support our program, but it's also supported by the evidence around protective factors as a framework. So then the other piece was the program level assessment, which again is why we're using the protective factor survey, because it details the outcome of a program against established measures or expected results to determine if it's achieved objectives. So again, that's an evidence-based tool that's being included and trained to all of our staff that are utilizing it in the field. Okay, so how do we use it? We use the protective factors survey and family peer support services at intervals depending on the length of the program. So the programs in which we use it for currently are, it's threefold. Two of the programs are similar. One is Family Navigation, which is a very short-term program. It's only 60 days. And for that program, we only complete the protective factor survey with the family one time, and it's retrospectively at discharge. So we're asking them, what was your experience like over this last 60 days? For our two longer programs, a Family Peer Support for Behavioral Health and Child Welfare, which is on average a 6-month program for families, we're completing the survey at intake or pre and at discharge post, and then measuring the difference. So for both programs, it's built into the requirements that we have as far as intake and discharge paperwork, so it's built into that process. So it's completed by parents in two different ways that we do it. One is by virtue of having a hard copy available for families that prefer that method, and then they can mail it into a self-addressed stamped envelope that we provide. Or the preference that we find from families is to actually complete it online. We have an online data management system that also houses all of our assessment tools, and the protective factor survey is one of those. So we can provide a family with a link into Pyramid that allows them to anonymously complete the survey, and it tabulates the results there online and connects it back to their family in our data system. So it will give us the assessment, and it will do a comparison between the pre and post to give us an ultimate scoring mechanism at the end. Participants are asked to respond to a series of statements, and you saw those Likert scale questions about their family, and it's a 7-point frequency or agreement scale. And the data is entered either by the parent or the family peer support worker, and like I said, it calculates the data, but it also calculates it in more than just that overview. It's calculating, based on the family peer support worker, the family organization, the region, and then our statewide network, so that we have an ongoing comparison of data and know where we need to improve. So the reports are used clearly for our QI process. It becomes a huge part of our QI process in the feedback loop. And the data that we take from that not only goes back to each organization, but goes to our funders and also is used as part of our statewide planning efforts. The data is compared within the organizations that are using the family peer support model and are not family run. So this is allowing us to do some comparisons now. So once we started using this tool in Nebraska, and in conjunction with our online data management system, we started getting calls from other entities in Nebraska saying, hey, we heard that you're collecting protective factors information. And so it became more of a push to how do we consolidate and how do we look at data statewide and compare and contrast and grow as a system. And so we are now we are subcontracts to have organizations that are subcontracting with us for the use of Pyramid in order to use the protective factors framework so that we can do those comparisons. Data is provided to funders as a measurement of program success, and again, that's part of that ongoing system comparison and growth. With every tool, there's always implementation challenges, but that's part of the fun of it. So some of the things that we experienced were in the very beginning, the transition was difficult at first. So that we're not only implementing a new tool to 8 organizations across the state, we have all the data that we need to migrate from our old assessment tool to our new, and the timelines associated with that, and maintaining the integrity of the old model and the new model, and figuring out ways to connect those pieces of data so that it made sense moving forward. And then creating a whole new infrastructure to support the data that we are collecting, including a way to measure, assess, and adapt. Creating the training opportunities for staff was clearly a really important piece. If family peer support workers weren't comfortable with the tool, we found that it wasn't getting done. And so we had to do a lot of pushing as far as how can we support them in understanding it and practicing it and using it in the field. I can tell you now that folks really like the tool because they like to have that data and what it looks like for them as an organization. Adaptations to Pyramid with our online data management system, like matching the time frames, testing the new module, again, the adaptations, standardizing the reports, and working out glitches. Those things are pretty standard with any new implementation task, but were cleared up relatively easily. We're happy to see that. It created an understanding, appreciation, and commitment from the affiliate network of Nebraska family organizations. So at first, though it was scary for folks, what we found is that everybody was really excited about it, and now looking back, the feedback that we get from the field is very positive, and they like being able to have an evidence-based tool supporting the work that they do. It also provides us a great amount of data that we use in writing grants, that we use when we're having discussions with our funders, that we can take to our systems meeting and have shared conversations that make sense to everybody involved because we're all speaking the same language. So it also, of course, has successes whenever you're implementing. So some of the growth things that happened for us were that it created this whole array of rich data that we didn't have before. And it allowed us opportunities for reconnecting with family peer support workers in the field, within their organizations, within their communities. And it became a movement that was observed by the funders that we share the data with and our community collaboratives, and it also created additional funding streams for us. It provided opportunities to look at how we can improve our services to families as well as our organizations and our systems in Nebraska. It normalized the necessity of focusing on programmatic outcomes and how to help families achieve personal success. And it assists us in developing conclusions about family peer support services and how it helps families. And it has allowed programmatic growth. In fact, the next piece that we're moving on to is implementation of the promotive factors, which is the youth-gauged version of the protective factors. So it's aimed at building those same types of factors for young people. So then we'll be able to use that for the families that we're serving within family peer support, but also those youth that are transitioning out of family peer support into adult services. Okay, so this is just an example of some of our outcomes that we collect as a result of our protective factor survey. So in case I wasn't very clear in the beginning, we measure protective factors in two main ways. One is on the individual level, which means that we're using a series of informal discussions with families, and it's literally check boxes that are outlined around the 5 protective factors that help us assess and then determine where we need to go. So we use that as our informal mechanism, and then we use the protective factor survey as our formal mechanism, and then the satisfaction surveys and some other tools in between that support some of this work. But these are our main outcomes that, again, relate back to the protective factors. So we're measuring resiliency, we're measuring concrete supports, social connections, and knowledge of parenting and child development. And then we just began the nurturing and attachment outcome. Okay, so determining if the protective factors survey is the right fit for your organization. I hope that everybody takes the time to research and look at all the wonderful tools out there. It's not maybe a right fit for everyone. It was a right fit for us in Nebraska based on where we were organizationally, where our state was systems-wise. But some questions that you can ask yourself: will the respondent, which is the parent or caregiver, receive at least 6 hours of direct services from your program before they're given the post-test? So if you're just doing a resource-only kind of service, this might not be the right fit for you. Is the respondent the primary caregiver of the child or children for whom the guardian or parent is receiving services? Do you provide services or supports that address each of the following protective factors? And it's those 5 again: the resiliency, social support, concrete support, nurturing and attachment, and child development, knowledge of parenting. And that is all I have for the protective factors survey. Again, I think Millie has it set up so we can answer questions at the end. I have a lot of tools that I could share with folks that are interested in how we use it informally and formally and tie it all together to provide more data-rich information. So I'm happy to share that with anyone who's interested. So thank you.
Thank you, Sarah. You really made an excellent point about choosing a tool that fits what your organization wants to focus on. That's important for every organization. It has to fit. There's lots of questions about the PFS, so there will be time for responding to those at the end. Next is Nancy Craig of Families Together in New York State. She's going to share her experience in developing and using the Family Assessment of Needs and Strengths, or FANS, in her state. Nancy?
Thanks, Millie. I had myself on mute, and I've been telling myself, don't forget mute, don't forget mute, and what did I do? So thank you very much, and everyone that's on the phone. Wow, it looks like almost 70 people. Hoo-hoo, don't get nervous. We want to talk a little bit about how we in New York came to this, and we wanted. I speak in pictures, so having this slide kind of hones in on what we're doing. We want to work smarter, not harder, with what we're doing. And I think it's always important to figure out how you do this with partners. This is not done alone. As Millie alluded to in the beginning, this is a subset of the CANs developed by Dr. John Lyons and his crew of people. And New York became a CAN state back in 99, 2000. And it just made perfect sense that we would look at some of the tools developed to the CANS questions and see how they align with the work of family peer support and the model in New York State. So I believe that it's important to say thank you to people, and it was a challenge to get to where we are, but all the family peer support programs in New York State came together, and this is our statement that we believe this tool can do, that it demonstrates when parents are connected with family peer support that they experience this increase in knowledge and enhance their skills, and to meet all the challenges of raising children with social, emotional, behavioral difficulties. In New York, we have a model that covers these areas. So I wanted people to say this, to be able to see that this is our framework, that we do outreach and engagement, and transition, self-advocacy. We're very, very big on self-efficacy, and I'm going to talk a little bit more about that as we move along. So like Nebraska, we wanted a tool that did more than one thing. We're very, very busy, and families are very busy, and we wanted to be able to measure and look at outcome and data across these areas, that by using data, all of these areas are interconnected, and that each circle influences the other in some manner. Parents' goals influence how my program as a family peer support director works. It also influences the larger child serving systems. Supervision, our tool, the FANS tool is great in supervision with our advocates, whether you're doing one-on-one or in group supervision. And the most important, it's important for families to be able to set their own goals and talk about that. I do want to share that the tool is that we use fidelity to Dr. Lyons' model, which is training, lots of good training about how to use the tool, how to administer it with families, and that there's a test. Dr. Lyons is, when you work with the CANs, it's a 75% pass rate to have greater reliability. So in New York, the western part of New York has been using the FANS and developed over the last 8 years. And the rest of the state in the last 2 years has been rolling it out, and we've been gathering lots of momentum about and around the tool. And we have a little bit of data that the state Office of Mental Health has started to collect. So our tool, we like to call it clusters. In the CANS world, they call it domains. We like to put things in a little bit different slant. So our questions cover self-care. They cover the parent's knowledge base and skills that they believe they need to be productive and healthy and move forward through all of the transitions of human service and the needs that their children have. The third cluster hones in on the self-efficacy and the burden and stress. We believe that when families can believe in themselves, which is how we define self-efficacy. Not necessarily you have to do it and be good at it, whatever it is, but you have to have that belief first that you can at least try. And then to acknowledge that raising children with substantial and complex needs causes some stress in our life, and how to manage that stress because usually it doesn't go away. And I think it goes back to what Nebraska was looking at, those protective factors. And then our fourth cluster kind of homes in on all of the satisfaction. Am the school working with me? Am I working with the school? Do I have some needs about where my child lays their head at night? That's our living arrangement question. And some of these questions are, we help the family come to the realization that this is about their life. These are family-driven. So if a family believes that they need help in an area, this is self-reporting in the moment that we're doing this, this work with the family. It's not about from the advocate's perspective. It's not about from the clinical partner's perspective. It's truly about the parent. I was doing a training a few weeks ago in New York, and one of our clinical partners said, well, this is very, very subjective. And I said, well, you're darn tootin' it is, because that's about our life. That is, and you can't get more subjective than that. That's about an individual family's ability to understand who they are and what they need. So I love the tool. I can't ever speak enough about it. I think it shows and helps families identify areas that are important to them and then to grow from those areas. So our scoring is a 4-point scale. 0 is no evidence of a need. We don't have to do anything. Parents, we have a hard time in family peer support not doing something. But parents and families come to us with lots of skills, and this helps our family peer advocates back off and identify it and help and see that in parents. One, we call it watchful waiting. It's a prevention kind of thing. Might need a little tweaking here or there. And in 90 days, which is our timeline, every 90 days you're going to re-administer the same 17 questions all over again and get the kind of a reading on where the family is at that moment. And we either look at decreasing that to a 0, which gives no evidence of a need, or bumping it up to a 2, and our 2s and 3s are action statements. Those things have to have a plan, and then a 3 would be an immediate and priority change. So it's what you're going to do a lot of in a short period of time. Let's see. Oh, didn't move. Here we go. The fans can be, Dr. Lyons said once a couple months ago when I saw him train, he said the fans can be this external catalyst for the discussion on difficult topics. And I thought that's so poignant because we have, as family peer advocates, we have difficult conversations. And even though the tool is the family's perspective of where they are in any moment in time over a 90-day period, it's still our responsibility as family peer support to address what we see as maybe challenges or things that we could be helpful with. It's an active role. It's not just passive. So it's important that people understand that, the family can administer this, but they have, our role as family peer support, of course, is to support and nurture their actions. So the fans is the parents' documentation. I can never say that enough. This is about their individual strengths and needs, how they've identified it, and not an interpretation of anybody else. As an advocate, as family peer support, I get to guide and say, gee, have you thought about this? But if a parent truly does believe that it is a 1, a 2, or a 3 on a scale, then that's what it is. The adage that we can lead a horse to water, but you can't make him drink. And when I'm training on the tool, I tell the family peer support people that you're allowed to give them a glass of water, but you can't throw it at them. No one makes change in your life unless you want to make change. And this 17 questions helped guide that conversation to make a change, to learn a new skill, to see what I might need as a parent to be able to raise my children or my child. So it's really important that, and it's important to the work that we do, that we meet families where they're at. So our timeline in New York, this is what we do in New York, we build that relationship, that conversation. You cannot talk enough. Within that first 30 days, that's gauged by how well you could go with 45 days if that's what you needed. And then we update it every 90 days after and at discharge. And in New York, we're getting ourselves ready for Medicaid managed care as that comes down the pike real soon. So we want to make sure that this is not a standalone, so that wherever the family goes next into the system, that we pass along the work that the family has done, that the parents and caregivers have done, and that there's that they don't have to start from scratch. We come with skills, we've gathered skills. People should know about that, and we pass those on so that wherever the next level of service a family lands, that continued work can be picked up from that place. So that's the tool, but it's only as good as if you do something with it. And that's what we found, that it's really great. Wow, we have all of this great data, these 0s to 3s, and now what? And it's important that this is a living, breathing document. You don't just get to file it away and do nothing with it. So it's not paper and pencil exercise. It's just not something else that the state or our funding wants to see in a record. That it's the parent and the FPA create this written action plan based on the priorities. And the priorities are at least those 17 questions that scored a 2 or a 3, as well as other areas. The 17 questions do not encompass everything that our family peer support people do. When we looked at those questions, we wanted to make sure that we picked questions with validity to them, to the work that we do. We do a lot more. These are the big kind of topic areas. And then we incorporate those into service plans and action plans. So the goals are the methods for the child's success. In this world, everything has to be tied back, and that's what our tools will help do. And especially since we're a CAN state as well, it's good to kind of see that overlay between the CANs and the FANs work. So we like to make sure that people understand this is not just the Office of Mental Health or Nancy Craig saying we have these great things, but we actually talked to our family peer support and got some feedback from them. So what they said, it keeps everybody focused on why they're involved. And it helps the family peer support with their role and goal. Why am I there in their house 3 or 4 times a week or a month to help them? What am I doing? It helps guide that and make sure that we have relevant and attainable goals, and that they're family-driven goals. They're not just some, picked out of the cloud. And that it also helps the parent identify their skill mastery and empowerment. It's black and white. We can put it in a pie chart. It's a little hard to argue that I said 90 days ago I needed a lot of help with social resources, and 90 days later I told you, shoot, I made like 4 new friends, and they've been, very, very helpful. We've traded off kids. When I see that in black and white, because in my world, and in family peer support, there has to be a goodbye. We need to allow families to live outside the bubble, and this helps me see that I'm ready to live outside that bubble. It helps identify the skill mastery for the family peer support worker and any development needs, and of course the supervision. It is so well used. The directors of our family support program in New York State have all said that their supervision is much more meaningful. And actually one of the directors a couple months ago said to me, I was a lousy supervisor before, now I'm a good supervisor. Not great, just good. The better I get at using the tool in supervision, the better supervisor I will become. Again, it keeps the focus on the role and maintaining these healthy boundaries. And it validates the success of the family to the program and the parents and our funders when we can talk about that. And then the very bottom line is that in the near future, all of our funding is going to be valued at this outcome level. And if we didn't start sometime, we're not going to be ready when Medicaid managed care comes to New York State full force. And we've asked parents, what do you think about this? In the years that we've been using the tool, not one family has said, hey, I don't want to do that. I'm not interested in your form. They've all been able to say, oh my gosh, I've really become much more active in my local community. Some of our families have become great regional and statewide speakers on topics for family peer support about why it's so important. They have ownership over the change that's happened in their life. They have a better understanding of how the systems work and how to affect that change. I personally feel, from my own use of this, it decreases that feeling of overwhelmness that I have as a parent, like I just don't know where to turn. I don't know what I'm doing. And this really helps me focus as a parent. Here's what you got to do. This is how we're going to do it. Greater confidence in my own abilities. And the bottom line is we've got strong, empowered leaders for sustainability as we move through generationally. Now, this is really kind of hard to see. This just came out on Monday from the Office of Mental Health. They have a data system for the state, and Family Peer Support has just started to enter. So the N on this is very, very small. But I'd like to draw your attention to the very far where it says involvement. And again, the N is very small. So 7% of those families that receive their first SANS scored either a 2 or 3. That's the gray. The blue, in 90 days, and I get a little emotional over this. I get a lot emotional over this. In 90 days, 100% of those 7% have changed their view about that question. And this is involvement says that I'm a great advocate, that's a 0, or I'm a good advocate, that's a 0. A 1 would be that I have a history of seeking help and I, work the plan, if you will. A 2 says, life is unbearable and I don't think I can do this anymore. I don't want to be involved anymore. And a 3 says, I can't be involved anymore and I want my child to be removed from my house. So in this question, in this slide, 7% families said that they had a 2 or a 3. And in 90 days, 100% of those 7% said, I get it. I'm going to do this. I am involved. These are my children. This is my child. And only in 90 days, I was like, oh my goodness, I can't believe we did that great in 90 days. But we did. I can believe that. Connection with another parent living the same life allows that to happen, that tomorrow can be a better day than it was today. So the rest of the areas, everybody kind of got okie dokie. Everybody moved a little bit, but that is telling. I think it's telling for our profession. So I can't wait till I get some more data by our programs to be able to see great movement in all of those 17 areas like that. And a little bit of implementation challenges. I hate talking about implementation challenges because I think every challenge is just an opportunity to figure out another way. So one of the biggest challenge was how to keep true. A change is difficult. Someone always said, our children don't do well with change. Well, heck, I don't do well with change. I like to do it because we always did it that way, and what the heck do we have to change it for? Well, sometimes new things, look at, we used to cook in an oven and now we get a microwave. So that wasn't so bad. Now I can eat in 30 seconds instead of 3 hours. So family peer support to stay true to who we are. We don't want to change the greatness that we bring to the system. Training of the workforce and staying true to the model of CANS, Dr. Lyons of CANS. We follow all of those rules. So training up a workforce in New York State that has an average of 400 advocates on any given day in 100 different programs is a daunting task, and it takes time because the tool you just don't train and then use. It has to, really be, as Sarah said from Nebraska, you have to really internalize all of this. And, it's bad enough trying to learn something new at administrative level, let alone at the direct service level that they're overwhelmed as they are with working with families. So, again, some of that trials and tribulations is ourselves, to remember that it's not about me, it's only about them. It's about the families that we serve, not about our own life. The system itself, family peer support, is not a clinical program, so being and having validity to a tool that is used in a clinical manner and reminding people that we have no clinical questions because we're not a clinical program. And it's about the parents' strengths and needs, and that our work is not specifically tied to the child, to the identified child. There's no linkage there. There's a hope that when a parent becomes stronger, and I think this is the anecdotal part of our data, that I know when I got stronger, my son's illness still had to run its course, and I got stronger faster than he did. So that sometimes is a problem for funders, that we can't tie that. Did the child have because the parent gained strength, did the child sit in their seat in school more days? Did they not have penetration into the acute units at the hospital? We're not saying that. We're saying that I got stronger, which made me better able to manage what came my way. And then this agreement and development of the standardized process, like how are we going to do that and who's collecting it? And as you can see by the last slide with our data, we're still working on this. We're still trying to get people to do that. And this is what I think of us in family peer support. We're all just hanging out together. Everyone's, keeps everybody's eye on the prize, the living of life as a family, without this huge intervention or intention of mental health. Life happens outside of us, and that's what we should be helping families get back to. And we should always be working on saying goodbye to the families that we work for. So thank you very, very much. If anyone has questions, hopefully we can get to them, or my contact information is there, and we'll be happy to chit-chat with you. Thank you, Millie.
Thank you so much, Nancy. You pointed out something that I meant to point out earlier. Everyone has included their contact information. We do have a lot of questions coming in. I'm hoping we're going to be able to cover that. But if not, we'll make sure that you do have the contact information for all the presenters so you can reach out to them individually. Our last presenter is Celia Sirkin. She's the Executive Director for the Montgomery County Federation of Families in Maryland. She collaborated with Dr. Bruno Anthony at Georgetown University on the development and implementation of the Family Journey Assessment, or FJA. Celia?
Yes. Good afternoon. I so appreciate this opportunity to participate in this webinar, and I want to thank FREDLA for allowing me to do so. We are a local family organization in Montgomery County, Maryland, and we have family support partners who work in the context of wraparound, and family navigators who work with families who are not in wraparound. Both family support partners and family navigators are family members who have raised children who have mental health and behavioral health challenges. And they help family members progress on their journey towards self-advocacy and self-efficacy through the acquisition of skills, knowledge, and a network of support. During the recession, many of our programs were getting cut, and there was beginning to be an emphasis in our state around evidence-based practices. And in this climate of results-based and outcome accountability, an emphasis on evidence-based practices, as well as a challenging, very challenging fiscal environment, we became aware of how critical it was for our family support organization to understand, what we were doing and how much we were doing, how well we were doing what we were doing, and was anybody better off. And so I approached Bruno at Georgetown and asked him if he would be willing to help us create a tool to be able to help us look at peer support and what peer support was to accomplish. You can actually go on the website at Georgetown, and the tool is there, the manual is there, and you can actually see a vignette of the tool. I'm trying to figure out how to move the screen. How do I move the arrow?
It's the arrow at the bottom.
And I'm just trying to, okay, I got it.
You want to use the one on the right. There you go.
Great, thank you so much. So Bruno worked with my staff, all of whom are family members, for over 3 years. And we then looked at the tool in the context of family support experience. So when we were evolving the tool and creating the tool, we looked at such things as self-knowledge, communicating need, accepting and appreciating strengths, challenge of self and child, well-being and reduced self-blame, knowledge-seeking, collaboration, and connection to decrease isolation, using acquired knowledge, coping, increased activation to gain knowledge and to become actively engaged in child care and services and advocacy. So we were having a rich dialogue that oftentimes funders were very interested in how peer support affected child well-being, but we felt there was merit, and I think Nancy addressed this very well in the previous presentation, about how peer support affected the caregiver's journey. And if the caregiver was better able to handle his or her circumstances, was there merit in that, separate from just improvement in child well-being? So when you look at the evolution, the creation of the family journey assessment, you can see that it developed directly from the experiences of the parent support provider, in our context, the family support worker, and the family navigator, and the goal of family support, which is that importance of that movement. And for a family member, that journey is not linear. We move forward, we move back as caregivers, and it's, we have new crises that evolve, and we are able to handle things within our progress has to be looked at an evolution. And so this process and the experience of this journey is unique. The tool is also comprehensive. It's less about the satisfaction of the youth's progress and related services, but it's really related to our specific skill set knowledge as caregivers raising children with mental health and behavioral health challenges. And it focuses on the progress that would reduce the impact of caregiver burden, working with others, problem solving, coping, and implementation of gained knowledge and skills. So we were very interested in this because our mantra within all our programs is the acquisition of knowledge, skills, and a network of support. So it's not only that you're gaining knowledge, but it's how do you use that knowledge. And then within the family camp, it's getting a network of the support that helps the family progress on their journey. So the worker completes the journey in the partnership with the family. It's not a tool that's done to a family, but in partnership with the family. And it's integrated into the work that the worker is doing. And the supervisor certainly has a dialogue using the language of the family journey assessment to help shape the work that is being done. It tracks that family member's progress in that journey towards self-advocacy and self-efficacy through that acquisition of skill, knowledge, and a network of support, and then it provides indicators for the specific level and content of peer-to-peer skill building and support. So the SGA is that collaboration between the worker and the family member, and it integrates into the ongoing work of family support, and it informs the focus of the work. So we didn't want to have soft data. We wanted to have hard data that says, what should I focus on? If mom is great at building collaboration, but she's having a harder time maybe in understanding how certain strategies work in a particular arena, then we need to know what we need to focus on. The worker needs to understand where to put the emphasis on in a given activity, and this helps shape that. It helps to develop an individual plan of action. So when we develop a family support plan, whether in family navigation or when we're having a dialogue within a wraparound context, of course in a wraparound context, just one plan of care, and all the data from everybody, formal supports and natural supports, have to be integrated in the wraparound plan of care, then the family support partner needs to bring the data to the child and family team and share that. So the family worker can say, well, this is what we need to work on, that the journey is showing, the tool is showing needs to be an emphasis. And then we're tracking and celebrating success at all stages in the journey for the family. So the family journey is not just one more assessment, so it's not an evaluation of the parenting skills, it's not an extra add-on, and it certainly is not a research project with no benefit to the family or the worker. And the family journey assessment is not an evaluation of the staff's proficiency or a job performance measure for the staff, but it certainly can be and should be used in supervision. And the language of the family journey gives a glossary of terms that can be used in how the family worker is doing work with the family. The family journey assessment language can empower the family, because I know even when I was younger and trying to raise my children with special needs, I needed language to attach to my activities. I needed to have something to describe my experiences. And the family journey assessment now can give language to what families are going through and can help describe progress. There are 36 items in the basic scale. We did develop, and we're still going to be looking at this. We have a basic scale. We had worked on a wraparound scale. We also worked on a legacy scale, but those are still to be evolved, the legacy scale and the wraparound scale. The basic scale has 36 items. There are 6 clusters. The clusters are self-knowledge, family well-being, seeking information, collaborates with others, uses newly attained knowledge, and coping skills. So if you look at this, the rating scale, there are 4 levels. And again, the journey that a family has is not a linear process, but it's related to what does the family's need for the assistance of the worker. So you have intensive, moderate, supportive, and empowered. So an intensive, the family member finds it very difficult to make changes to improve the current circumstance and requires active intervention from the worker. In a moderate, number 2, the family member needs extensive assistance and encouragement from the worker to make changes necessary to improve the current situation. Supportive, the family member needs limited assistance from the worker to make changes necessary to improve current situation. And empowered, the family member is making changes to improve the current situation without the assistance from the worker. For the administration of this tool, again, this is a way to track the progress of the work together. The clusters are linked to the purposes of family peer support: information, advocacy, support, coping, and collaboration. Baseline We try to do it within 2 weeks. If a family is in crisis, sometimes it's going to be within the first 4 weeks, because you have to address the crisis first before you can develop baseline. And it's a use in a discussion format, and then we hopefully, because we have programs that range from 14 weeks to 18 months to 2 years, so we try to do it every 3 months or at the end of service, and celebrate success at every stage in the process. There is a cover page that is filled out, and it keeps track of caregiver, family, and the rating and ID numbers. Comments need to be done because things could happen that influence the data that's collected, a hospitalization, an arrest, that could color why a certain rating happens at the time that the tool is administered. It is a semi-structured interview process, begins with general open-ended questions organized around the clusters, suggested follow-up prompts. The interviewer needs to have a good understanding of the tool and experience in conducting this kind of tool. The family staff person has a dialogue with the family member and reconciles any difference between what the worker is seeing and what the family member perceives is a more correct answer. And throughout the interview, it is important to remember that we always tell the staff to be open and non-judgmental. There are general prompts. There are specific prompts, and we try to make sure that the worker does not read the tool as a last resort. We make sure that the worker truly understands the tool. In terms of scoring guidelines, we make sure that the worker should integrate their current knowledge of the family, information provided by the family during discussion around other conversations with the family, observation, as well as information from the youth, natural and formal supports, and other key stakeholders. It should reflect the family's average level of functioning during the last month. Use observation and reported information in making rating, and try not to use what the worker thinks the caregiver's skill is or knowledge should be. And we tell the staff to certainly understand that there will be fluctuation, again, that the journey is not a linear process. In terms of scoring, we tell the staff to certainly they need to take in consideration such issues as gender, life experience, cultural heritage, social economic circumstances, belief and values, that they should not impose their own value judgments that they are influenced by their age, their gender, their social class, their cultural background. There's a lot of emphasis on cultural competency. That they are always to work with the family as an equal partner, and that this is a partnership with the family, and to try to use the same procedures for gathering information, such as talking to the same family member, to use the same interview format for each administration. For training, there is an initial in-person or video conferencing that would be done at the Georgetown website. There are 2 online videos, and the scores would go back to Georgetown and receive feedback. There's a video or audio recording. They practice FJA interview, and that would be sent to Georgetown University and get feedback, and then additional feedback is given. Also, when the tool is administered, the results can be sent back to Georgetown, and Georgetown can actually record the results and give you some very interesting data back to you. We are looking at the next stages of implementation. So again, this is a new tool, and we're now at the stage of looking at implementation strategies. And if you have any questions, I did give you our contact information. Bruno's information is down there as well as mine. And I agree with a number of the comments that have already been made about implementation challenge and some strategies. This tool cannot be done without a lot of training. And even though my staff developed the tool in partnership with Georgetown University, there needs to be a lot of training, a lot of supervision, and constant coaching to ensure that the measure is implemented well and in true partnership with families. Thank you very much.
Thank you, Celia. There's a lot of interest around the FJA, and there's a lot of questions about it too. So I appreciate you sharing what that has looked like and the implementation issues and the positives. We are now going to have time for questions from the attendees. We've had quite a few. And so I'm going to try to group them according to the different measure that was talked about, if that will work for everybody. There were a couple of questions about the PFS. For example, is the discharge done by phone or mail? Sarah, if you could speak to that one.
I'm sorry, I missed the question. I had myself unmuted.
As well. Oh, that's okay. Is the discharge done by phone or mail, and who determines the discharge?
The discharge it's really determined by the family as it relates back to the service provision. We have set standards within our program that determine, like they're indicators of when the family would discharge, and then the family makes the ultimate decision. But as far as the measure goes, as far as the standard time frames of discharge, that is considered the last 30 days of service, and so the survey is completed within 30 days following that date. So it's a rough time frame, but no more than 30 days after the service is completed.
Mm-hmm. Okay, thank you. Also, is there a tool for the family level assessment, or is it just simply a conversation?
Well, there is a list of pieces that go into each of the protective factors, like areas, categories, and which tie back to it. So we created our own tool in Nebraska that helps guide the conversation. So staff are trained in how to utilize that tool to have discussions and elicit conversation, and then use that as part of their a tool to build the family plan. So it's not a formal tool, it's something we created.
Okay. There was a lot of interest in receiving some of the tools that you talked about, Sarah, and what you're doing with the PFS. Like you said, it is a free tool, so maybe we could get some of those from you and include them in the follow-up email to everyone that is attending today. Would that be okay?
Yep, absolutely.
Okay. Okay, thanks, Sarah. The fans. There was a question about if the fans had a cost to it, but I think that may have been answered already. But maybe, Nancy, is there a cost associated with that? I know the cans is free.
Yeah, the fans is free as well. Other than the training, as Celia said, it is about the training, it is about the coaching and the supervision. So just as the cans comes with a training component that there's a cost to do that. You bring people together, costs a little bit of money. But the actual tool itself is to be used, and then any of the data collection, we do that via our state office right now, and each program keeps their own on a database.
Okay. So the FANS is actually administered by agency staff and not a third-party evaluator.
No, it's done by the FPAs, by the Family Peer Advocates, and in conjunction with the family. It's you never just do this without setting up some of the questions, because some of them they need a little help. Some of them aren't as family friendly as we would like.
Mm-hmm. Okay. Is the FANS ever used in conjunction with high fidelity wraparound or intensive care coordination?
We don't have. Well, we do. A couple of our counties have high fidelity, and they use it. Especially in the western region, Chautauqua County had a Assesment Care grant. and they used it, and Erie County as well, they actually used it as part of their outcomes for the system of care. And our intensive care coordination is called Home and Community-Based Waiver in New York, and all of our home and community-based waivers have been trained in it and are implementing it in conjunction with the CANs. I see one of the questions was, have we ever looked at that? And that's, up until this point, we haven't had someone, we haven't been able to collect the data to that level, and then someone independently to analyze it. So right now, the system that the state uses, everybody's starting to report into that, and then the state office of mental health with their evaluation department is starting to produce the data. So hopefully by the end of the year, we're going to have a little bit more.
That sounds good. There was a question about whether the FANs have been used by agencies that were seeking to either engage or re-engage incarcerated persons with their families and their children. Do you know if that's a population that this is used with?
And as far as I know right now in the state, no. We've never used it in that manner in the FANs in New York. And as far as I know, New York is the only, well, New Jersey uses the FANs, and 8 system of care sites in Florida use the FANs because we've trained them. So, but I've not in New York. That is not a population that I've heard of that uses the tool.
Okay. And are you looking at the FANs in multiple states, together, so that there's a national report on its use? I know they do that with the CANs. You can pull up a whole map.
Yeah, we have not done that through New Jersey or through Florida yet because I don't know how to do that. That's not a skill I possess. And since I'm the trainer of it, I guess that might be a skill I might have to possess at some point. But it would be nice. It would be nice if we could figure out, how we could get someone to do that.
Yeah, it would be very interesting to look at. The Family Journey Assessment, is that available now for people to review and to use?
Yes, absolutely. You can go onto the website that I have on there. You can actually see, look at the tools there. You can actually look at the information, and you can contact Bruno. And I want to acknowledge and thank in this webinar Bruno's wonderful work he did with us, and acknowledge how important it is for family support organizations to work with universities. And we'll be glad to support you if you are interested in using the Journey Assessment. We'll be glad to work with you around your using the tool.
Thank you. There was another question about the FJA. How much time do you feel it takes for coaching and for mentoring staff? Like just an estimate.
I think it's an ongoing process. I think you have to weave it into the way you do business. Just like any other process, it's not a one-time thing where I'm going to do coaching 1 month, and I think that with the protective factor or with FANs, it's the way you do business. You weave it into the way you do your work, and you have to build it into your infrastructure and make sure you have solid infrastructure to do the work.
So you also put it into like supervision processes.
Absolutely, absolutely. Your coaching and supervision, you have to have it on that level, but also in terms of your funding. How are you funding to ensure that you have someone for the data collection, and that your supervisor has time, within his or her work schedule that they're going to be doing this. That when they have supervision with either group or individual supervision, that they're going to be talking about this. And, are they reporting this out in a wraparound context to the team members? How are you reporting it out to funders and your report mechanism? And it has to be woven into all different levels of your practice level work.
Okay. Across all the presenters, do your organizations have staff who are providing the services? Are they the ones that put the information in databases? Or have you found that it's better to have a position that does that? One person who is focused on making sure the information gets in?
I think it's...
Go on, sorry.
Okay. I think it's helpful to have a data person to enter the information. I think that's my opinion. This is Celia.
Mm-hmm. And this is Nancy. Each of our agencies, depending on size, some of the larger agencies programs have the ability to have a specific data person into our statewide system. It's a secure system, so there's a training and a secure login for each person that enters the data. So most of those agencies usually have one person, and sometimes it's a supervisor of the program or the director.
Mm-hmm.
And this is Sarah. I think it varies based on the family peer support specialist and the organization. We have it occur in a lot of different ways. What's interesting is what seems to be most popular, particularly for our younger parents that we're working with, is that they enter it themselves. They become part of that process of going through the check boxes. They like that, but they also like completing the survey themselves via the link that we provide them. Our advocates will take their tablets out with them and hand them over to them and let them do it themselves. As far as entering it in other ways, we encourage our family peer support specialists themselves to enter it because it becomes part of the process of developing the plan and assimilating that information as they're entering it. So, but I think it works okay any way you choose to do it.
That's a good point. Concurrent documentation is pretty popular, and it does include the family in the process. We are about out of time, so I wanted to let all the attendees know that the PowerPoint and one of the materials that was discussed today are available. You should be able to see where you can download that on the screen. However, there will be a follow-up email that will include these things, as well as a transcript from the chat box from everyone. I've been so impressed with the amount of resources people have been sharing back and forth throughout this whole presentation. We really are a community of family organizations that support each other. It's nice to see that. So it will probably be next week before that gets out. And then if we can gather the other materials that presenters mentioned, we'll try to get those out to you as well. The contact information for the presenters were on their slides, so feel free to reach out to them. I do want to thank all of our presenters today for sharing their experiences, and thank all of you who have participated in the webinar today. So enjoy the rest of your evening and be looking for the email next week. Thank you very much.
Thank you.
Thank you.